Welcome to the Igniting Impact podcast brought to you by Public Knowledge. I'm Stacey Moss, your host and president of our management consulting firm. Our firm's vision is to be a catalyst for change, leaving each person, project, client, colleague, and community better than when we started. The Igniting Impact podcast is an opportunity to share what our clients and partners do daily to make a difference in the world. And this season's theme is all about change. Change is everywhere. It's in our work, in our systems, in our communities, and within ourselves. And this year, we're looking at ways to approach it, to manage it, and to adapt to it on our teams, on our projects, and in our organizations. Today, I welcome two guests from Public Knowledge to the podcast. We have Kassie Graham and Melissa Murphy, who's joining us for the first time. Thank you both for being here. Let's go ahead and start by just getting to know you each a bit more. And Kassie, if you don't mind starting and just sharing with us a bit about your professional background and what you do for work today.
Yeah, I'm really excited to be back on this. My ideal job is to be able to sit and wave my hands a lot and move my mouth. So I always love being on the podcast. So I have been with Public Knowledge I just celebrated my 14th year anniversary in June, which is a pretty exciting milestone for me. And I kind of gone through a lot of transformation over the years. I started in public relations and moved into working in a regulatory environment under actually elections. And that's how I kind of got my government chops. And then kind of went through a couple of software project management work jobs. And then I landed here at Public Knowledge, where for about the first 10 years, 9 to 10 years, I was heavily involved in consulting, where I specialize in organizational change, strategic planning, and worked predominantly with our Medicaid clients, with also some other and the family services and SNAP and TANF worlds. And then I've been in this position as the senior vice president, leading the business development team for 4 years. It'll be 4 years in November. And it's been just a really exciting way to I really consider myself a consultant, just in a different manner. Rather than implementing change, I actually help identify ways to solve tough problems and get the right talent to help people navigate through those changes.
Totally agree with you. I feel like that too. Still a consultant, just in a different way and different clients.
That's right.
All right. Thanks so much. Mel, how about you? Can you tell us a bit about your professional background and how you got here and what you do for work today?
Sure. Thank you for having me. So my professional journey is pretty storied. Sometimes I wish I could answer this simply and just say, I've been in one place for 30 years. But honestly, I wouldn't trade my past. So I have a master's in social work, specifically in administration. So I worked in quality management for a number of years. I worked on accreditations for an insurance company and a hospital. Then I took a decade off to raise my 2 kids. And then from there, I went back to school for a master's in public health. And I knew I specifically wanted to work in government. And at the time, I was living in Wisconsin, and I basically just started harassing people in DHS and finding any way I could to get in front of them until they finally hired me as a policy analyst. And I also did research for them as well. And at the same time, I was consulting for a nonprofit who eventually recruited me as a director of program operations. And I was also pursuing a PhD in community health and training for an Ironman. So it was an energizing time in my life, to say the least. So now I've been at PK for 2 years. I primarily work with North Carolina on the Child Welfare Transformation Project as one of the task leads and as a task team member. I'm the deputy project manager for North Carolina's Adult Services contract. I'm a Medicaid IV&V consultant for the state of Maryland. And finally, as part of my health and Medicaid industry lead role, I assist with writing proposals and I participate in business development activities.
That's great. Did you finish an Ironman? Did you do one or more than one?
Several, yes.
Okay.
Yes.
How many?
Yes. I am retired now.
I always think that looks like the most torturous thing on the face of the planet. Okay, perfect. Well, thank you guys for that. On a more personal note, I'm wondering what principles or values shape how you approach change in your life. That's our season theme. And so we're trying to look like both professionally and personally. How do you approach change? Kassie, do you want to start?
Yes, because this is perfect because I jump right in. That's how I handle change. Sometimes I've kind of thought, oh, what did I do? Okay, well, we'll just figure it out from there. But historically, I embrace change. I'm ready. I'm ready to start a change and then navigate my way through and kind of make adjustments as I go.
Awesome. Mel, what about you?
So sometimes I think the reason I like being a consultant is because of the change. So your clients change, markets change, my roles change depending on the project. Personally, I've changed states I've lived in, relationships, friends, jobs. So change is challenging and it can be really, really uncomfortable, but the end result is almost always growth, even if the change feels bad at the time. So I've really had to look at it from that perspective, and then change becomes easier for me and even welcome. So it's kind of like a muscle that you have to constantly grow, challenge yourself.
And I love that analogy to a muscle. I'm with you. There's no doubt that being at public knowledge for as long as I have is because it changes every day. And I'm doing the same thing day in and day out. And that for me is huge and something that I never had in any job before, which is, I think, why I didn't stay for 30 years. And I have that here, and it's pretty magical.
I would agree. That's kind of the siren's call, I think, about the work that we do, because project management overall, I will say, that's a theme as well. That's why I've been a project manager, I would say, my entire career. But I think that's what makes the management consulting business, is that there is always a problem to solve, and it's not always the same problem. Sometimes it is with different people. So it does bring around a lot of change and a lot of interests.
Yeah, and I think it keeps us very energized, right, about the work. I think the opposite, though, it can be challenging, right? The work of a consultant or a project manager can be really challenging if you're not comfortable with change. And I think we can see that sometimes in our colleagues, but I think often I see that with our clients sometimes as well, right? Because you have people who aren't comfortable with it, don't like it, need to know the why. And unfortunately, we don't live in that type of a world day to day.
Right.
Right.
Okay, well, thanks so much for sharing a bit about yourselves. Today, we're going to talk about the health and Medicaid field and how we make decisions in the midst of uncertainty and change, which we're definitely in a lot of right now. Kassie, if you just want to kind of give us an overview of why you chose this as a topic and kind of how we want to approach this today.
Yeah, so really what we wanted to bring is, with the changing landscape that we're all living through, kind of positives and negatives around really the funding mechanisms, the federal funding mechanisms and state funding mechanisms that really drive the work that we do here at Public Knowledge, as well as the work that our clients do. There's just been so much change, and there's been big communication about what the change might be, along with a lot of anticipation around what that means. And then really coming down to, okay, well, here is what the change is when it comes out, and what do we do about it? And so really what we wanted to share today and kind of talk about the decision-making process in the world of ambiguity, and how there are ways that can kind of help build resilience and tools that are available to people, and work that we have been able to do and lessons that we've been able to learn around how can you build in process that helps you and your teams and our clients and me even navigate decision making with all of the changes and with all of the ambiguity that keeps rolling out, and kind of future proof, not necessarily on a decision, but how you make decisions and how you go about navigating the changing world.
Yeah, I love this topic because I think it's so important, right, in the, I'm going to say, like, post-pandemic world, right? I think the pace of change has just changed so dramatically. And I love the future proofing, right? It's not about making one right decision anymore. It's about making the best decisions you can day in and day out, given the data that you have at the time and the amount of time you have to make it, right? Because we don't have the luxury of enormous amounts of teams or time or resources to like make the perfect decision all the time, because so much is changing.
Yeah, absolutely. So we have been kind of discussing the One Big Beautiful Bill Act that just passed, and then the budget reconciliation. And so while this is today's topic for, where the three of us are sitting right this moment, but there will always be another big, beautiful bill. This will continue to be a world and a landscape with high stakes decision making that we don't have the luxury to ruminate and collect data for a year to be able to make a decision and make the right decision. So really helping create these tools that are easily accessible so that it can be made a little bit faster, and is exactly as you said, Stacey, kind of incremental. And how do you build that into the fabric of your organization so that it is something that becomes, going back to the muscle, is it really flexing that muscle and building that capacity?
Yeah, becoming part of your culture, right? Rather than just individuals. Okay, well, let's talk about some of the tools in the toolbox. Mel, do you want to introduce us to one or two?
So yes, I want to go back to the timely decision making. I love this topic because as someone who has a background in research and evaluation, leaders sometimes make decisions based on logic and anecdotal information with a rationale. Well, it seems like a good idea. This program we're implementing, this service we're going to fund, whatever the decision is, they kind of make it simply because it just makes sense. And when you're working in like a fast-paced, high-pressure, ever-changing environment that we know states live in, they do have to make some swift decisions based on whatever information they have, like right in front of them. So I think some of the tools is really that market research and alternatives analysis. And it may not always be top of the mind, but it's so critical to invest in. And, you were talking about the new big, beautiful bill, and that includes funds for rural health transformation. And historically, funds for rural health would go straight to the rural hospitals, but now states can use anything from disease prevention to health information technology. There's no specific requirement to fund actual hospitals to address their fiscal challenges and population needs. So states really have to scramble to make decisions about how they're going to use funding, or they risk losing it as early as 2027. So I think as far as tools go, that really digging now into that market research and alternatives analysis is definitely an area that I think PK is well positioned to help states to use those tools. And we can help them synthesize all the information that compares these systems, programs, and services in order to make those best decisions possible.
Well, and really to optimize the funding, right? I think there's so much about that for health and human service agencies is how do we optimize the funding that we can receive? And in this time of potentially less funding for health and Medicaid agencies, what does it look like to make sure that we're using everything that we can, right? As something goes away, something new is being funded, and how do we pivot? Kassie, what about you? Any other tools in the toolbox that you would suggest to our listeners?
Yeah, so Mel mentioned the alternatives analysis, which is actually one of my favorite things that we do here. It's kind of one of those, I don't want to get too deep in the weeds because it's exciting for a nerd like me, but really the best thing that I can say about it is that it really lays out the objectives of the decision making, lays out all of the alternatives, and then actually creates a very structured and criteria-based evaluation that a large group or a small group of decision makers can go through. Therefore, all of the data gets out on the table in a fairly quick manner, and everyone has an opportunity to say their piece and kind of share their thoughts around it. But then it creates what the output is really, in the end, just a justification of what everybody has agreed to based on being able to give their input and see the sense, or see the reasons behind other people's decisions. And so it creates this amazing buy-in and a real kind of alignment. It's a real way to get great alignment on the decisions that are being made. And I've seen that time and time again, and kind of every single time I see it, I'm in awe of how the most different of decision makers can actually come to the same conclusion from a different way, and being able to listen and look and hear at the input from each other. And it's again, one of my favorite things that we do here at Public Knowledge. And I know everybody does this. It's just still wonderful that we all can do it. And I would also say the other thing that's in our toolkit is the rapid readiness assessment, which is, especially now, again, when we're talking about having to make decisions quickly with the information at our hand, this rapid readiness assessment is a very quick way to come in and assess the landscape of the organization, to understand where they are in terms of ability to accept change, whether they've been through change saturation, whether or not they have not had to go through change, which would be an amazing place to find. That would be a unicorn right now. but kind of understand what the landscape and what leaders are actually going to come up against and it's, again, it's in a qualitative data measured way rather than kind of anecdotal. And so we are able to help leaders understand where the organization is, what they're ready for, where there have been issues in the past, and help identify those to move forward as they start to get ready to make a change and make these decisions.
And is this rapid readiness assessment, Kassie, is it meant to prepare them for one change or prepare them for change in whole?
That's a great, thank you for pointing that out. Really, it's about getting the organization into a framework to be able to make decisions and be ready for all changes going forward. I think one of the tenets that we actually don't talk about as much externally, but internally, we say this all the time, that our role as consultants is not to be the ones always there kind of as the creating all the changes and helping the leaders implement everything. Our role is to help the leadership, the organization, all the way down to, the last person in the process be able to adapt to what's next, right? So we will coach them on how to implement the structure and the processes in order to do the next thing that's similar. So it's not about that implementation, that change right then and there. It's about the ability to be able to sustain and do for themselves, and knowledge transfer and sustainability. And so that's really what this is focused on, is teaching the people at the organization, these are the tools that you have available to you that are already in your organization, and how to strengthen those areas where they're already strong, and then identify areas for development that could be a quick fix to resilience in future decision making.
And I think really what you're talking about is that cultivating a strengths-based approach in teams.
Mm-hmm.
So along with the readiness assessment, like we also have tools like the Hogan assessment and the DISC assessment, and those help to identify those diverse personality and leadership styles as well, and like how people work together on a team, communication styles assessment. So I think all of those things work really well together in an organization.
They do.
Yes.
And I want to come back to that. But real quick, I think I want to make a point, because if we look 10, 20 years ago, when you're doing change management or you're helping an organization with change, we did always do readiness assessments, right? But we did readiness assessments for that change, right? At that point in time. And not just us, everyone did. And I think what is so great about where we're headed, right, and I think has always been in our ethos, but is now part of kind of how we're doing the work, is not just preparation for one change, but how do we, like we've talked about, how do we embed it in people? How do we embed it in the culture? How do we make the organization more resilient as a whole, and to see that strengths-based view and to see this as an opportunity rather than something that's going to harm them? And I think that's what's so great about using that type of a tool, right, is it is about increasing skills, upskilling, right? And dealing with all of it, not just one point in time.
Exactly. That is, it's just, when you think about it, even down to your personal life, right? If you go to a therapist, not saying we're not therapists, but if you were to go to a therapist, right, your point is sometimes you go there for a very specific reason, but ultimately what you're looking for is the skills to be able to move on past your 8 sessions or whatever's allocated to you, right? So that's the same way I would see as our consulting, is that it's about exactly training the skills at the larger level, kind of all the way up and all the way down, to be able to really take on everything that they face.
Yeah. So Mel, getting back to what you said before, I'm curious, how does this work help amplify what you're talking about, like different perspectives, making sure that those that are affected by the change, that they're heard? Like, how does it help improve inclusion and teamwork?
So something that we really encourage any state we work with is to incorporate the voice of lived experience in decision making. And of course, this takes some extra layer of time and effort, but without that step, decisions may appear to look really good on paper, but in real world operations, it could fall flat. So even internally at PK, I find it's extremely rare that decisions are made in a bubble on projects. Our project managers consult the entire team, allow any dissenting voices to be heard, even from the proposal stage before we're even awarded projects. a lot of thought and intention is put into who the staff will be, how they will work together, what roles are they best suited to serve with consideration to their current workload too. And all of that ground level thought means when we're awarded projects, the team's already set up for success to fully serve any client that we work with. So I really think that, including all of those people in the processes that you're trying to roll out really makes a difference.
Yeah, and I've said this on the podcast before, but two of our core values are inclusion and teamwork. And it's interesting that you guys wanted to talk today about decision making, because for me, those are important for that reason. I mean, I have other personal reasons for those being important, but if I think about the business and why those are important, it is about getting to the best decisions. Because if people feel comfortable speaking up when they have a dissenting opinion, if they feel like they're on a healthy team where they can do exactly what you said, Mel, and actually share their perspective, even though it's different than others, we get all the information out on the table. We get everyone's perspective, and therefore we're not missing something when we get to the decision-making stage, right? Because someone didn't speak up or we didn't have all the information. It just leads to so much better decision-making. And in the world that we work in, the world that our clients work in, that's really what it's all about, right? Is how do you make the best decision in that point of time and quickly? And if you have a healthy team where everyone really feels comfortable in speaking up, you're going to get there quicker and you're going to get better decisions at the end of the day. Have you seen that in your work?
Well, I have on my projects teams. I mean, when we talk about inclusion and belonging and collaboration, I mean, communication has a lot to do with it. And I think about it as like a wheel with spokes in it, right? That's how I think about our teams. So the wheel is your overall project, the spokes are your task teams. And even though those teams may have different people on them, you're all working together to turn that wheel. So good communication is really critical, but it's kind of easy to say, oh yeah, teams need good communication, right? This seems kind of obvious. So it goes a little deeper than that. It's more, they don't only have to have access to the information, but like the mode of communication is important too. So you got to think about the content of what you need to communicate and then tailor it to the person and the significance of the content. So like, for example, I know when I communicate with certain people, they always prefer email no matter what, right? Other people, I can just video call without notice, which generally is not super popular with a lot of people. So some people want a meeting invite, but I think foundationally, it's important to learn about each other's communication styles. That builds a sense of belonging and inclusion and collaboration, and that facilitates better decision-making overall, so you can spin that wheel a little faster and all work together.
Well, and I have another kind of I'll flip this a little bit differently where when we use the words like inclusion and belonging, I am currently on a team that is comprised of someone with a lifelong background in project management and IT consulting. That's me. I'll raise my hand. And then a couple of others that have a lifelong career in child welfare. They probably mostly identify as being like a social worker. That's where they kind of still put that pin on as, oh, I'm a social worker. And then we have a few other folks that are kind of really, really tied to kind of education background, teaching, training, and coaching and that sort of thing. And it's interesting when you look at how how are you going to make decisions with those like 3, 4 really very different backgrounds, because kind of even when you just take the generalization, right, about kind of how each one of us might approach the interpersonal communication and that sort of thing. And so without building that trust, without building the healthy team, without understanding and building a safe place for being able to accept kind of my lived experience versus their lived experience in all the ways up and down that means, we would not have, we might be doing the same things that we've always done, right? Or we could be doing something wildly different. And so the power behind all of that decision is embracing how different our backgrounds are and allowing us to talk about those to be able to come to a decision actually faster than I think it would in any other terms without being able to build up some of that communication.
Faster, and the ability to have that healthy conflict, right? Because I think those differences of backgrounds and experience and values and focuses is so important, right? When we're making important decisions, and having those perspectives and the healthy conflict around it gets us to the best decision. Okay, well, so we talked a little bit about our core values and inclusion and teamwork. Our other one is impact, and I have a couple questions for you around that. The first being is, what are you watching or measuring to ensure that your work is having the impact that you want it to have, or that the work is having the impact that the clients want it to have?
I can talk about what we're doing in Maryland. So we've been closely watching system usability post go live. So especially how end users interact with new workflows like eligibility verifications and referral processes. But we measure success not just by the technical milestones, but also by how consistently the changes are used and whether they streamline effort for people or improve the overall outcomes. And one thing the team in Maryland prioritized is to identify bottlenecks early. And we do that by using error logs and stakeholder feedback, aka incorporating the voice of experience like we talked about earlier. And in doing that, we have evidence that the system is working if we have to escalate fewer issues longer term. I mean, in general, just as Medicaid IV&B consultants, we measure impact of risks and issues by assigning them a rating depending on the significance of the impact, and then also assigning them a rating by the probability that it's likely to happen.
And even that goes back to all the way back to the decision making too, right? So when we go through our IVMB processes against standard conditions, standard expectations, standards, I'll just say, you can go through and you can match back to kind of how that decision making as it goes along the pathway around requirements, around features, around fill in the blank. And then you can measure that back to kind of, does it meet the core standard that this was intended to meet? So that's another way that we can also measure the decision making process is, are you ending up with the thing that meets all of the criteria that you decided on kind of going through the process? So that's one way to look at it through an IVMB lens. Mm-hmm. I would also say that one of the things that we're doing internally when we're talking about kind of rapid decision making, right, or high quality decision making is really what we want to talk about. High quality, rapid decision making is probably what we're all really aiming towards. But we have what we use internally that we're actually kind of helping promote the evidence or help share the evidence around this is really internally we call them the 4 core measures, which are 2 of them are about on time, on budget, and then we have impacts that are related. But the on time and on budget are 2 ways that we can utilize to measure the success of decision making. And that's based on our own projects, but we can see when we filter out just those projects that are around strategic planning or just the main kind of the point is about decision making. So our market research and our alternatives analysis or our rapid assessment projects, we then can say, okay, well, here is the length of the engagement. Some of them are 4 weeks, some of them are 4 months. Did we end on time and on budget? And then we follow the impact of it. So that is a really great way to tie in how quickly the decision making gets made. So if we allocated 4 weeks to it, then that we track how long that project is and the decision was made, because that's the intent of all of those is that we leave them with a decision. They've made the decision and we've helped with all the justification behind it. And then how long does it take them to implement that is the impact part that we monitor as we go. And on this case, I don't want to toot our own horn just because it's at this point, this is a very small N. This is something that we're just started, but all of our strategic planning. So I would say, we're 100% on the on time and definitely 100% on budget. But this is, as we start to watch this trend over time after having implemented it, it'll just be fascinating. And then watching the impact, which is the part that we all care most about. Of course, like the business, as the business of public knowledge, we care about on time and on budget. But as part of the human side of our business of public knowledge is the impact that we're really driving for. That's why we're all here. That's why we turn on our computers every day. Mm-hmm. And so being able to match that with the fact that we are seeing the results of the work making the impact that we want, I think that's how we can tie it together, and that's how we're measuring it.
I love that. I think what I love about what you said is like tying the plans to the beginning, right, to the impact that you're seeing at the end. But we know that change isn't always linear, right? And things often go wrong or change in the middle of a project or an effort. So if you guys think about kind of navigating change. How do you handle when you have to pivot or rethink or readjust your plans?
So I will tell you, when we go through the alternatives analysis, the market research is the precursor to that, right? So that is the part where the kind of road splits is through the research. That's where we find it, is let's look into these types of things. Let's look at these types of activities so that it will inform our decision. Oh, wait, how about this? How about this? So this is where we can chase all the shiny objects. But the best part about, again, another reason I think I love about the alternatives analysis is because it does take all of the chaos and then it puts it through a funnel in which it removes the need, not at the opportunity, but the need to have to take a different path midstream, right? So we can go all the directions we want, but once we move into this alternatives analysis funnel, then we're actually applying the criteria. And maybe the criteria might change a little bit if we talk about not being nonlinear, but usually it doesn't. We've thought through that with our clients. And when I say we, I'm talking about our clients as much as we as PK, but that's all been considered and come together to filter through. And the second best part, I would say, because I've used best part of all of over and over, but I love the nonlinear can also happen in the conversation still within the confines of the structure of the alternatives analysis. So it is still maybe not a straight path, but it's still within guardrails. And then when you come out, everyone is aligned and you've been able to have really deep conversations around, I'll just pull out one criteria we often use is like the political nature of the impact of this decision is, will it get funded or will the legislature decline and reject this opportunity because of XYZ, and really considering what's at risk, what's at stake, and how they'll navigate it. So actually, when you come out of it, you've already done a lot of deep thinking in advance of implementing the decision. And so kind of you get to go through all of that kind of beautiful mess. And then it feels concrete. It feels solid. People often are proud of the process that it took to be able to get to this decision. And there's just a real sense of accomplishment around all of that because it was less messy kind of all along during the real decision-making process.
Well, and you're looking for those risks and mitigations and those other plans to occur, right? And know about it ahead of time. Planning for what you can plan for.
Yeah. Exactly.
Yeah, when I think about like the projects that I'm on and the task teams, we are constantly pivoting and thinking about how we can approach things differently and presenting it to a client in a palatable way. Lessons learned, we keep lessons learned logs and we meet almost daily to talk about, what is working with this client? What maybe do we have to rethink and do a little differently? So we have so many tools and assessments and strategies available to us to really help with those projects and things that we thought were going to look good on paper. When you start to operationalize them, maybe we do have to pivot a little bit.
Yeah, I think what I found is, when your job is to solve hard problems with tough problems, there's never a straightforward, easy answer, right? So, and actually, Mel, you went right where I was headed next, which is if you look back and kind of reflect and think about lessons learned, I'm wondering what comes to mind for you. And the one that I'll share real quick that comes to mind for me is just that. Like, it's so hard when you're not solving the same problem all the time, right? To know that your approach or your way forward is the right one until you've tried it. And you have to try it, right? You have to iterate and you have to try it and you have to fail or see that it works. And sometimes seeing it failing is just as important as seeing it's working because then okay, that's not going to work. Let's try something different. And doing that quickly and being comfortable with that is a hard skill, but it's so, so important in this environment and in this industry because we are solving problems that haven't been solved before. Mm-hmm. What other lessons learned do you guys have for our listeners?
So my mind goes directly to an experience I had right out of grad school. I had this supervisor who was so tough to work for, and he would get really upset whenever I'd make a minor assumption. But I'm so grateful for that guidance because throughout my whole career and my personal life, I have always been surprised every time I make an assumption before I make a decision because it's almost never spot on. So in the health and Medicaid industry, for example, I want to assume that the administration will fund things like data health modernization and emergency preparedness sufficiently, especially since we just came out of a pandemic. But instead, we see the CDC is going to see a $70 million decrease.
Yeah.
And that makes like states and counties who are already underfunded for public health really have to look at their data and population and make tough choices about programming. So I think I'm just constantly being surprised that with all we know about population health in 2025 and the fact that clinical care alone doesn't make people healthier, prevention does. We're still seeing this politicized view of prevention with deep cuts to it and this reactive response to population health.
It's so interesting because that's such a topic in really all the industries that we work in. If I look across the board, this kind of back and forth between, are we focused on prevention or are we focused on fixing the problem after it's there? And it's so important when it comes to health. But it is interesting how that similar conversation is happening on different topics in our other industries as well. Thanks for that one, Mel. Kassie, any lessons learned that you'd like to share?
Yeah, it's funny. It's kind of on the same vein, but one of the things that I was thinking about with this one is that so we often have clients that come and say, especially with the big beautiful bill that was just passed, and say, okay, here we're having massive changes to, I'll just pull out one of the millions of things in that bill, but we have these massive changes to rural health, right? We want a group of experts that know how to get this funding, but it's never been done this way before, right? And so that's where I think the thing that I would rely on the most is that, okay, well, we're a team of experts at navigating things that have never been done before. And so I think that's one of the lessons learned that I just, when we're out there looking for good people that we work with, both on the client side and as well as internally, is that finding that kind of, I guess, consulting mindset about, here's my toolkit. I understand, like Mel, I understand public health. I understand research. I understand analytics, and I'm just curious. And then how do I take the toolkits that we develop as public knowledge from, that's where our experience is, right? Mm-hmm. So when you are asking for expertise, you're asking for expertise in how to really get to the root cause of it. And while, yes, I do think we still need to overlay it with subject matter expertise around the program, because it's really important. I don't want to diminish that, but it's as important as having somebody that's really, really strong at helping you as the leader navigate the unprecedented thing, And of course, I'm saying this to a number of people that I'm sure we're all tired of unprecedented things. And so I think that's where my perspective is coming from, is like, okay, here's another thing. Let's just dive right on in.
Well, I think what you're bringing up, Kassie, is so important. It's not just important for our clients when they're thinking about hiring consultants, right? Like, I do think you're exactly right. If I was advising a client on who to hire, I would say you want to be hiring someone with the best and deepest and longest consulting skills, right? Because then we know they can solve problems, they're curious, they're creative, they're innovative, they can get to the root cause of what's actually going on and help you solve your problem, right? Not necessarily the person that knows the most about your industry, because as a client, like, we expect them to know the most, right? But it's also important, I think, for our clients as they think about hiring staff as well, because I think for them and who they hire and who they have in their employment is going to change too, right? And is very different than what they may have been hiring for 10, 5, even 5 years ago, right? Because they also need to be stacking their deck with people who can deal with change, can deal with ambiguity, can deal with uncertainty, can help solve problems, who can be innovative, and who can be resilient, with the pace of change these days. And I think what you said is so important for us, but I think it's also very important for them.
Yeah, it really is. I mean, we've seen that. I think that's probably one of the top requests that we're seeing right now, is kind of help with their changing workforce on different levels, right? It's helping get the knowledge and subject matter expertise. That's some of it, right? But it's how we're seeing, I think we saw 5 RFPs come out recently about even just how do you deliver excellence in the public service space.
Yeah.
So, I mean, we're going all the way back to things that I've never seen that in my career. Of this is where mass trainings around that sort of thing. So I think that's where, going back to what you said, is making sure when you're kind of, I guess this is still about decision making, but making sure when you're hiring that the decisions are really about finding skill sets that are adaptive, that are creative, and that are kind of resilient because of everything that we're going through.
Yeah, I'm probably going to mess this up, but it's like the Swiss Army knife. Is that right? The Swiss Army knife employee.
Let's see where this goes.
Did I get it right?
Yes.
Okay, good. Like, it's so much better to have the Swiss Army knife of employees rather than the one, like the spoon employee, because you really do want someone who has more than one skill to bring to the table. And like you both, because this is true about you both, is also interested in learning what comes next, right? Like, what's the new thing, and how do I learn that, and what does my professional development look like, and how do I move on to the next problem? And I think that's so important for our clients to be thinking about as they hire, and also to build that in their current employees too.
Absolutely.
Okay, so if you look back, and you guys are both leaders, so let's give a little bit of advice to the leaders that are listening. And I've got just kind of 3 questions for you for leadership and kind of insights about them. The first one is just a reflection and kind of what has surprised you most about your journey through change as a leader?
As they navigate, the complex nature of decision making, I think people's first reaction or instinct is to react to a change, whether that be emotionally or in action. So they immediately give a directive or send an email about a change. And I'm super guilty of that too. But I think the best leaders understand that there's power in the pause. Stop and think. What evidence is available? What people can you ask? What departments, resources can support you in making a decision that will have the most sustainable impact over time? Because we talked about before, like, that's really the end goal, is that sustainability. And I think that's really hard to do for states, especially with all the fires and the pivots they have to deal with. And again, this goes back to the readiness assessments. So, to get them to help them to make decisions quickly, we can use those rapid readiness assessments and to just take that pause and assess their department without sacrificing that time.
Yeah, well, I think what you're really talking about, Mill, is emotional regulation, right? And when I do leadership development with our clients, it's something that I talk about a lot, right? Because as the leader of a project, of an initiative, of an organization, of an agency, one of your most important roles is to create calm, right? And confidence and courage in others. And it's really hard to do that if you can't regulate your own emotions. And so that power of the pause is something that we talk about a lot, because your emotions and your feelings are very different things, right? And if you can get past, and they actually say it's only 90 seconds, if you can get past and pause for 90 seconds, your initial emotion of that is going to pass, right? And allow you to bring in your rational brain into the conversation and into the room and into your presence with others. And it's so important. And it seems like such a small skill and such an easy skill. And it is so hard to do. It's so hard, but it's one of the most important things. So I love it. Thanks for highlighting that. Kassie, what about you? What surprised you most about your journey through change as a leader?
Strangely, I consider myself, and don't laugh out loud if this is not the case, if my my understanding of myself is off base, but I consider myself a pretty solid communicator. And it's interesting that navigating through the changes that we've been going through, both internally and externally, how much of the reaction, kind of to Mel's point, is about pausing as well, but around the communication along the way. And so that has been the biggest thing for me, because it's such a simple and obvious thing that I think the amount of communication is probably the lesson learned, that I'm kind of hey, I've said it, and then I've said it a couple of times, and I've done it in all the ways that I think every learner needs to and wants to hear. But then I always forget that it takes up to 15 times, 8 to 15 times for something to actually be heard and understood. And so that's where, I mean, there's science around this that I seem to choose to ignore sometimes, that I'm really bringing that back into my practice and really making sure that I am communicating. And there's a difference, right? I'm kind of an informal leader. That's one of the things that I like about myself is I like to be authentic, and that's true all the way to my core. And so knowing that just an informal way of communication does not always work with everybody. So I'm also working really, really hard on myself and self-awareness about how that is actually coming across. So even though I feel like I've said it 15 times, have I said it 15 times to this group? And that's really where I think my biggest lessons learned and kind of the surprises have come, that it's not as simple as it looks, because especially when someone only hears the one time that you've said it of the 15, and that's really what you want, but it takes the other 14 either come and go. So I think that's the thing that I've been working hardest on, is improving my communication and kind of how I communicate too.
It's so important. And it's actually reminding, I'm not laughing at you. I'm laughing at an experience that I had about this working with an executive coach a while back. And he told me, until you've said it so many times that you're literally sick to your stomach because you've had to say it so much, and you can say it in your sleep and you're probably dreaming about saying it, you probably haven't communicated it enough. And I probably viscerally reacted to that. I'm like, what? That's crazy. Yeah. And I assume, because I know I work with smart, wonderful people, that it's only takes that, but I forget that I, in my head, had been thinking about it and knowing about it for longer. And so it was at the moment, I was like, you're crazy. I don't believe you. But now, like looking back, that was probably 10 years ago, he was very correct. Like, until I'm dreaming about it, sleeping about it, I don't ever want to say it again without feeling nauseous. I probably haven't communicated about it enough. It's a really good lessons learned. Okay, so what is your advice for leaders as they navigate the complexities of change in today's world?
So I'm going to come at this because my background is in science and research, right? So my advice would be, I tend to rely a lot on evidence because of that. So my advice is, whatever decision you're faced with, chances are there's a tool, there's an assessment, there's a framework, some evidence-based structured approach that is likely already available to help you make that decision. So those tools can really help you identify your priorities, figure out who the decision impacts, who you need input from, and what questions you need to ask, and helping you navigate that complex situation. And they help you ask the right questions. So I think it goes back to what I was saying before about not making decisions because it just sounds like the best idea possible, right? Mm-hmm. Chances are there's going to be some evidence and research out there that helps inform decision making.
Love it. Kassie, what about you?
I think as an add-on to that, I would also identify kind of who you think might be, what group or person or division or department that might be your biggest barrier or resistor. And I'm not saying you use them as kind of a litmus test for the decision, but really work closely with them, as exciting or as painful as that may sound to whoever that might be. I think that is going to be the person, as you're working through the change, I think it's only going to strengthen, because it's probably it's most likely to be the person or the group or the division that operates most differently from you, right? And so helping understand and walk through their shoes will help strengthen that decision, and also getting them on board will expedite your decision making. And so helping bring them into the fold, help them, using the tools, the assessments, and all of the things that are available that Melissa mentioned, also bringing on kind of someone who you think might be the most difficult to either get on board or even make the decision with, and helping navigate that, and finding out other tools that maybe complement their style. So if you have a group that historically has trouble making decisions, maybe analysis or paralysis through analysis, or kind of working through that and helping identify where that's going to be when you're giving them the information that you would like them to react to and help with the decision. I think kind of really thinking through and planning. Actually, then I came through to my other one. The other one, I would say just plan it very carefully. So I think that's the other part, is understanding your where you're going to hit some barriers in advance and helping navigate that before the actual decision time.
Yeah.
And alternatively, identify your champions. Who's going to be your loudest voice and supporter, and recruit them. We do that in states that we work with. We'll figure out who the people are that are going to support whatever decision we want. So we identify those dissenting voices, incorporate their voice into your decision making, but also who's going to be a champion for you too.
Yeah. And honestly, they both need attention, right? It's so important. Yeah.
Mm-hmm.
Okay. How can leaders empower their teams to innovate and adapt in times of uncertainty?
I think this is really about, and this is something that I just read a Harvard Business Review article about, which is as we're changing through leadership, right? When you come from a frontline manager to like a director level where you have a few more people to an executive level, kind of the changing of how you change their decision making, and you're no longer responsible. This is where I'm at, right? I should no longer be making all of the decisions, and nor do I have time, right? And Stacey, and actually Mel, you're on this, on a project level. So this does apply to everybody, which is how do you move that decision making down through and helping people identify what their capacity is. And so I think that is one of the things that we use is we have a matrix, right? Where we identify who is it responsible for making the decision when and who they're responsible for actually getting input from. And that has been a game changer for us in helping people identify where they have the decision-making authority. And that, I think, is really the strongest tool because it helps them know. It also helps reduce conflicts when somebody makes a decision that they shouldn't have, or when somebody's not making a decision that they should. It gives you something in writing that you can reference back and say, here, this is what remember, this is where you are, and you have full authority to do that thing that you're asking to do. And you don't need to come to me, versus these are times that I really would like to be a part of, at least telling you what I'd like to see out of the result. And so I think that's been really, really powerful and a really, really powerful tool to identify and give that clarity.
Powerful and changing, I would say. I totally agree, Kassie.
I should do one for my family.
Yeah, no, agreed. Child, you get this choice, but you have to give me input. Maybe my entire extended family too.
Yeah, I think so. Good idea.
Melissa, what about you?
I mean, I go back to kind of just identifying how those different personalities and leadership styles work together and that DISC assessment. And I just talked about this in a meeting yesterday, but I shared a story with the group I was with. I was in a previous role and I was leading a team, and we were not working. We were not working well together. And we did this DISC assessment as a group. And guess what? I was the outlier. I was in a corner of this DISC assessment that no one else was in. And I'm like, oh my gosh, now I understand how my personality and leadership style is maybe hurting our team because of different personality and styles, right? And I was able to course correct because of that assessment. And it was one of the best tools and things that I've done. Because sometimes, the problem might just be you.
I feel like often as a leader, the problem is you because it's your.
It only happened once.
Same. It's only once here.
Right.
Only one.
It was a really great lesson to learn, right?
Good. I love that. Sorry, one other thing that we do when we get together as a leadership team, we go through Hogan assessment, or we have done the Hogan assessment, and then we compile all of them into the team Hogan. And that is always my favorite time of the meeting. Even we've been pretty stable, so the players are still pretty much the same. So we're just kind of revisiting, and particularly we bring up there's always one that we get stalled on because it's affecting something at that time, right? So it's just always really funny. And there are a couple that two of us, I won't name the other person to keep them anonymous, but one of their strengths is we're completely opposite of everyone else on the team.
Yeah.
And it's noticeable. I mean, that walking into the room, but it's pretty interesting that how much it really comes up
And like more than, yeah, it's interesting and yes, it's fun. But at the end of the day, your decisions are going to be easier to make if you understand how other people make them.
Yes. Yes. And where kind of why their decision, why they're struggling getting to where the rest of the team is or vice versa.
Right.
Yeah, it is.
Well, and there's less judgment and less wondering, like, why are they in a different place? Like, why can't they just get there, right? And then you're like, oh, I see.
It's in your DNA or whether, that's not exactly, no, it doesn't assess DNA, but it's.
All right. Well, before I close out, is there anything else that you guys wanted to talk about today or wanted to share that I haven't asked you about yet?
No, just thank you for having us.
Yeah, it's been great.
Yeah, it's been very fun. I really appreciate you both giving me some time today. And again, appreciate you sharing your insights and the stories. It's been really fun getting to know you and to think about the work that you're doing and how you're creating real change in our organization and also in our clients' organizations. I can't thank you enough for your time. It's been a real privilege to be here with you today, to connect, to learn, to grow, to breathe, and to share. Until next time.